Okay, go.
Alright, I'm going to walk in the room and then I'll ensure privacy by closing all the curtains. You had set up the number there. Hi, my name's Laura and I'm going to be taking care of you today. What's your name?
Sally Thompson.
Okay, and I'm verifying that with her bracelets, and that looks good. Okay, indeed Sally. So I'm going to be performing hand hygiene. Okay, put on some clean gloves.
And so before I go ahead and set up my sterile field,
Okay, I'm going to remove this glove because it broke. And I probably should have
as well as a basin,
washed my hands for a little, rubbed my hands together for a little longer.
fluid that is draining. And also at the very beginning I forgot to mention this, but I would have you want to set up my sterile field before you, which already is in place, but we need to keep it a little bit open for video purposes.
Okay. Alright, today we're going to be changing out your dressing and making sure everything looks good with your dressing. And then I'm going to be replacing it.
Make another one so that way I don't have to mess with
Close it. Okay, so I'm going to go ahead and take a look at your dressing. Oh, you don't have a dressing on. Okay, so I'm going to just look at your wound. Visually, if there were to be a dressing on at this point, I would. If there were to be a dressing on at this point, then I would have removed it and looked at it and made sure that there was not like any signs of infection, like purulent drainage or anything like that. But since there's not, we're just gonna kind of move over that. Oh, and also I would have been wearing a mask with like the eye shield, but that was not available in the lab, so, and I did not want to speak with a mask on because I figured you could not hear me, so I will not be wearing that today. Alright, so we're going to make sure the bed is adjusted to the correct height.
This is like such like a close camera. It's crazy.
Reveal our patient. Do you have any allergies, ma'am?
No.
Okay. So we're making sure there's no allergy alert bracelets, so I'm pretty confident in that. Do you have any pain right now?
No, I don't have any pain.
Okay, if she were to be having pain, we would go ahead and get an order for an analgesic, and we would wait 45 minutes after that to begin the procedure. Alright, so I've got all this on. I've removed the dressing, so I'm going to go ahead and take off my gloves because these are just to keep me clean while I was removing the dressing. Of course, I'm going to perform hand hygiene again. And then I'm going to begin to set up my sterile field.
I'm going to go ahead and place all of my needed supplies onto the sterile field, which there are no sterile ABD pads in the lab, so pretend that this is a package that I just opened.
Okay, I realize now that I should have put this under her while I was wearing gloves before, so no big deal. I'm just going to put on another pair of gloves and do that now.
For packing and measurement purposes, you apply them to the sterile field, dropping 4 to 6 inches above.
So to do so, I'm going to go ahead and close the curtain.
This one has already been fried, so pretend it was not.
And then whenever I work on the patient's wound in the abdominal area, I'm going to make sure that I provide him with plenty of coverage.
This is going to keep the area dry under your wound as we irrigate it.
And redo my
So I'm going to lift your leg just slightly and slide this under you.
sterile glove.
Alright, and then I'm going to go ahead and remove my gloves again. And perform hand hygiene again.
And we're going to open up the gauze.
Right, and now we're back to setting up the sterile field.
Now with this one, I'm going to open it up and I'm going to drop it onto the sterile field and then use the basin for water. Empty that there and then leave that on the side. And then this one we're going to actually leave.
Before I set up the drape, I'm going to go ahead and get some pieces of tape ready for the bandage.
So that way I can pour water into
And I'm going to hang these right by the side over here so you have easy access to them. And this tape's just going to hold the bandage
Now we're
on your
going
leg once we're
to
done.
take the water and pour it into both of the containers. So I'm going to check it, make sure that the date is correct and not
Alright, so we've got 4 pieces of tape
and
now.
I'll open it up and I will pour out a little bit of the
So we're going to go ahead and unwrap our drape.
into the trash receptacle and then we will pour. And then we'll soak.
And we're going to throw this in the trash.
Take that, replace it. This isn't needed anymore, so I'll just place it right over here.
Alright, and for this, I'm going to
Alrighty,
only touch
now
the
that that is
outside
all
inch,
set up,
and
I
I'm not
think
going to
we're
touch
ready
any of the
to
white
put
part
sterile gloves
to anything because that's part of the sterile.
So I able to place the gloves
prepared with
on the bed and put them on right there, so I don't
And
mess
it's okay
with
if I'm
my
touching the
sterile
edge because it's only the outer 1 inch.
field. I'm going to remove my non-sterile
Okay.
and then put them in a trash can. And then I'm going to redo my hand hygiene, wash my
And now at this point, anything that's hanging off is not going to be sterile anymore, so we're not going to
and
use
then I'm
this.
going to reapply gloves
Part.
and then use some of these alcohol based wipes to wipe down my area that I'm going to be setting up my sterile field on.
Now this is some sterile gauze I'm going to place onto the field.
And the very first step is to set up your sterile duration.
And that's going to be to clean out your dressing. And then here's the syringe.
Open this away.
And we're going to use the syringe to irrigate the wound with the sterile water we have there.
Table itself. And you want to make sure you only touch the outer corner.
Okay. And we have to make sure that nothing touches the outer 1 inch because that part is contaminated. Here's some more gauze. Some of this gauze is going to be used to cleaning it out, and then part of it we're going to pack the wound with. Okay. I should not have thrown that away. No, here's the main. Okay.
So now I'm going to take this. The middle of the paper is still considered sterile, so I will just discard that to the side. So now that I'm sterile, I'm going to make sure that I remain above my waist level. And I'm going to take the
Alright, and this is going to be
syringe.
used to
I'm
hold the
going to
sterile water.
unpack it. And I'm going to fill it up with the irrigating solution. Okay. And now I'm going to go ahead and irrigate the wound. So my left hand is my dominant hand, so I'm going to.
And we're going to
put
make
that
sure
on the
that
syringe,
every time we
and it
enter
will
something in the sterile field, it's held 4 to 6 inches
my
above.
right hand is going to go to the basin.
And
it's going
I
to
did
touch
forget
all of the
to
liquid that falls from the
grab
patient.
a
So I'm gonna go
little
ahead and
tray
grab
to
that.
put under the wound.
And I'm gonna hold
So
that
this is the part where I'm going to pretend that my assistant, I'm going to press the call light and have another nurse bring me a
water to
And normally this is
So,
sterile packaging.
drain until
Look away.
the liquid that is coming out of the wound is running clear. So now
I'm not sure the
here,
video
we're
is
going to take this and we're going to set it aside once we're done with that.
Okay, so this is a sterile tray that my assistant brought. So we're going to place this there on that field.
And
Now
before
we need
putting those
to
on, I'm going to go ahead and
pack the
perform
wound.
And we're going to make sure that this saline is in date, and we're going to put the label towards our hand and make sure we don't touch anything on the inside.
Off of the field,
Do I kind of say
and we're going to measure
And we're
the
going to
length
pour it in 4 to 6
and
inches above,
rake
making
it.
sure it doesn't splash.
Okay. Place that right there for
And
later
now I'm
on
going
for
to
measuring
remove
purposes.
the-
And then we're going to take, with my
These
sterile
Q-tips are
hand,
going to be used to measure the wound.
currently on my
the wet,
And these are sterile as
saturated
well.
gauze. And
So whenever you make
sure
whenever
that
you
it is
remove
not
the,
completely
dressing,
soaking
you
wet,
always
but it's
wanna make
not
sure
dry either,
that
so
you
it's
remove
saline
towards the
moistened.
patient so that he or she may not see
And so
the
this is my
wound.
sterile hand. I'm going to
The first thing
place
you're
it
gonna
in
do is
my
start taking
unsterile
my
hand,
little
and we're going to
finger
take the
shape,
Q-tip,
making sure that the
and we're going to place
dressing
it on
And the reason that we need 4 of these is that we're going to measure
are causing any
the
irritation.
least depth and width of your wound,
Um,
and then we're going to use the 4th one to go ahead and pack the wound with some of the gauze that I told you about earlier.
Now that the wound is packed, we're going to place that in the trash receptacle. And we're going to take some of the dry gauze, and we're going to dry the area.
For tunneling is you can lightly palpitate.
So this is my sterile hand. I'll place it in my non-sterile
So
hand,
that's going to be assessing.
and we're going to
That is no longer sterile because it touched the outer 1
without
inch.
removing.
So we could leave this in place, or we could also remove it at this point. But keep in mind this is not sterile. So I'm going to remove it, and then I'm going to go get another one, but I'm not going to turn my back on the sterile field while I'm doing that.
Piece of
And then
Okay, so here's a new sterile Q-tip, totally still in its package,
you'll redo your hand hygiene.
and that one's fallen in the right place. So we will now don our sterile
Then we'll
gloves.
take the
Use
ABD
your
pad
gloves, do your
and we'll
tape.
place that over.
Place your tape on the table that way.
And the outside of this is not sterile.
And then I will go ahead and remove my sterile gloves. Okay. And then we will perform hand hygiene really quickly. And then we'll take the tape that has already been
my hand hygiene again. Wash my hands.
ripped and
I
we're
like to
going
apply
to
my
place
sterile,
it
on my sterile gloves on my patient's
on the
bedside,
patient
and then
to
go ahead
secure
and
the
use
dressing.
Do you mind if I?
On the first glove, we're only going to touch
on the
the
side of your
inside.
bed, but
Just continue until all sides are secured.
Only touching the inside of the cuff to maintain the sterility of the outside. And then we're going to come up like this and slide our hand
And then I would
under the cuff
right on
of
the
this
pad
glove.
the date and time of the procedure and the dressing change. And so
And then
after
this
that,
hand
I will
goes in
put
like
my,
this.
You're gonna wanna apply,
I will
your
clean
non-dominant
up my
glove.
field.
Try to find where the thumb is on this one.
Okay. And I would go ahead and make sure that the patient
So
is
these are our sterile
identified
gloves, and now we can do this to throw
with
away
the
that.
correct first and
And
last
then
name.
using your dominant
And
hand to
then
glove
I
your
will
glove.
Alright, so at this point we're going
make
to go
sure that
ahead
he is in
and get ready to irrigate the wound. But first, before we irrigate your wound, we're going to need to just clean away any debris
so
that we
way
see.
there's no risk of
So I'm
falling or
going to
anything.
use
Clean up my
everything for
area
gauze
and
and get it slightly damp.
take that, place that in the trash if that's cool. Clean up my
And then I'm just going to brush from the inside to the outside. And I'm going to use a new piece of the gauze every time. And then from top to bottom of the wound. And then this can go directly in the trash.
That it was when I was like walking.
And now the debris is gone, so we're going to go ahead and use this
Okay,
syringe.
so
You're gonna want to use your dominant hand to don.
And this is a cap on the syringe, we just throw that away. And we're going to fill the syringe.
and then
sterile water.
Whoever goes next can just use this dressing to remove the old one.
Yeah.
There you go.
You will.
We're going to make sure to hold this syringe
Wearing a mask and a
above,
gown.
but not touching your wound. And then this hand is going to be just clean, no longer sterile, because this wasn't completely sterile anymore. And you're going to kind of push this up under to make sure that it's sealed, because we don't want to get your bed all wet. And then we're just going to kind of go across,
Dressing is already uncovered. You can go ahead
irrigating until the runoff is clear, and that would indicate that
and pat the dressing.
the wound is clean.
From top to bottom.
Leave that right there, remembering that this hand is just clean now.
Usually with a wound this large, you'll just go ahead and irrigate.
And this is still sterile because it did not touch the patient.
You're going to take,
At this point, we need to dry
cap on, you'll go ahead and remove
the
that.
wound, so we're going to take this gauze
You would have poured your,
and
saline
dry it
in this,
inside,
smaller
outside, and
container
then
to
top to
larger
bottom.
one. That way your syringe can fit in your, ear, and it won't be so hard to.
And then we're going to use the Q-tips to measure the wound. So we're going to see how long the wound is, and then we're going to break it off, and then just drop it.
And then you'll want to go ahead and run
And then we'll measure the
until you see that.
width of the wound. And we're not going to touch it because this hand is sterile. We don't want to touch the wound.
You can just go ahead.
Yeah, I was like shaking.
I feel like I'm gonna forget something. Yeah, you killed it.
And then we're going to measure the depth of the wound. And at this point, we would check for any tunneling, but there doesn't appear to be any tunneling in your wound. So, see how deep it is? Break it off right there. That's the way. And then the final part is that we're going to slightly moisten this gauze. Just a little bit. We don't want it completely soaking wet, but we do want it to be a little damp so it doesn't stick too much to your patient. And then we're going to take this.
And this hand is now non-sterile, so I won't use it
Fill
against
with your
your
water. Okay.
And we're going to pack it into the wound.
Okay, so
And this wound, it looks like it's not really going to stay just because of the way that the simulated wound is. So I'm just going to go ahead and take this out, but we're going to say that that stayed in. And then we would put a layer of dry gauze over the wound
to make sure
that we've just packed. But again, this isn't really going to stay. We might be able to do it.
moist or least moist at the top. especially in areas like.
So at this point, this should stay, and then at this point, we'll be able to take off our gloves now, our sterile gloves. Okay. Because the dressing has been covered with this. All right. The wound has been covered with that.
And then at this point, you'll go ahead.
And then we're going to perform hand hygiene again.
With your sterile.
Just imagine us on Tuesday.
And we're going to put on a new pair of just clean gloves for this.
Just like that.
At this point,
I'm
you
gonna
go
get
ahead
done in time. I'm gonna
and
take
remove your
Yeah,
sterile
I am
gloves,
too, and then I'm gonna
making
look here
sure that
next.
you wrap
Or I'm
one
gonna stay after
together.
Thursday after lecture for a little bit and do blood pressure
And then
and
you throw it
lab
away.
and then I'm
And we're gonna
come
apply
back
this.
on Monday,
Go ahead
because
and
the labs open
perform
like all
hand
day,
hygiene
and I'm gonna
again
spend
before you apply
And then we're going to tape it down just so that it doesn't slide off or fall around.
for the lab test. Do the blueprint.
Press it on there real good.
I know. Okay.
We'll start with the top so it doesn't fall off while the other sides are getting taped down.
And then I need a gown. I need a gown.
You want to shake mine?
Yeah.
Do the top first.
What are these? Oh, these are my brown.
It's kind of funky junky, but.
No, I just hide it.
And now I'm going to go ahead and down.
Oh, no.
Okay.
All right.
What you're supposed to say.
So now that this is all covered, we could mark the time and date, or we could just chart it, so that the next provider will know when this has been applied. And we can measure this now using the
You can go ahead and remove
scale to see the measurements, and then we would record the measurements in his chart as well. And then we can throw away all of these supplies.
And or their gown. And then you're just gonna want to make sure the patient.
And then with our gloves still on, we would have cleaned the whole area, but for time's sake, I'm just going to say that we did. And then we perform hand hygiene.
I have no idea what's happening.
So-
Like in bed, not getting wet.
And then wish them a good day and get out the room.
Here's my droplet one. I'm gonna spit on my gum.
But
Oh, I did 4.
All right.
Oh wow.
And then we're going to fold the gown in on itself and throw it away. And perform hand hygiene again. And that'll be all.
I'm gonna hit this